Hi, Shruti.
Hi, everyone. I'm glad everyone made it. Welcome. I'm thrilled to kick off today's Fireside Chat hosted by Aarogram. Whether you're joining as a practice owner, marketer, or healthcare innovator, you're in for a conversation that's equally timely but full of actionable insight. We're at a pivotal moment in healthcare. Patient behavior is evolving. Today's patients are digitally savvy, value transparency, and expect a seamless consumer like experience from the healthcare providers. They're researching care options online, comparing practices, reading reviews, and even estimating out of pocket costs, all before even picking up the phone or visiting. This shift is creating both a challenge and an opportunity for independent practices. Thriving healthcare businesses are meeting patients where they are, online, informed, and in control. That means rethinking the front door of care, and digital channels are now that for front door. What's also exciting is how AI is accelerating this transformation. From automating first touch communication to streamlining intake and estimating patient costs, AI is not just making digital engagement easier, it's making it smarter. Today, we are going to explore all of this with a stellar panel of experts. Dr. Avinash Par, who is a practicing physician and founder of Sleep, Lane Razardini from Sleep Apnea Leads, and Kashyap Purani, founder of Aarogram. I'll let them take it from here. Over to you, Kashyap. Are you able to hear me?
Am I- Yeah, there's an internet. Uh, Sorry about that. It's just all happening. Thanks for the intro, Shruti. I'm really excited. We have a very special guest today, and I've known Dr. Bar for a long time, so he's like kind of ahead of the curve among the all the providers I know. So very, I'm really excited to get his perspective. And then we have Lane, who is really, has a very interesting and unique work, and he works as a physician marketer. So I'm really curious to see his take his perspective as well. So let's kick off this conversation. And as Shruti said, today's topic is very relevant these days. I mean, actually, the topic is been old. We have talked and discussed about the digital channels to acquire patients and get patients for a long period of time. But there are a lot of other macro level changes are happening, so that makes it more relevant this period. So that's why it's a very uh, right time to take another look at it and look at it from different perspective with how especially AI technologies and everything is shaping. So let's just dive into it. I would like to start with Dr. Bar. If you could share a little bit about your background, how you first became involved in telehealth, and basically, what sparked your interest to using these digital tools to interact with the patients.
Yeah, thank you, Kashyap. Appreciate it. And my name is Avinash Bar. I'm a sleep, pulmonary, and critical care physician. The practice that we have is a virtual sleep practice. The name it's actually spelled Sleep, SLIIP, but it's pronounced Sleep. That was the cheapest way for me to buy the word sleep. It was mainly, the tele idea was a born out of necessity. I was initially after fellowship, I started practice in Middle Georgia, and Middle Georgia is a rural area where patients have to travel large distances. And when I was truly honest with myself, what I was doing wasn't rocket science. It was a lot of listening and trying to solve problems, and you can do that very easily. There was no reason for a patient to drive 45 minutes, wait over an hour in my waiting room, just to kind of me solve their problem in 5 minutes. And the large distance, I think, was easy for tele. And then you need one reason, and then the second reason that makes it stronger is that I hated the healthcare system I worked for, and didn't like the fact that I did not have a voice in managing patient care. It was very much just like any healthcare system. It minimized the actual ability for practitioners to actually have a voice to shape things, to make sure that, because we're on the ground, we're seeing patients, we know what they need. And I say we know, but again, it's we're much closer to the problem, and it was difficult for me to kind of bring about change. And that's where, and then COVID happened, and those three things came together, and it was an easy decision to go with tele. So we started the practice up in 2020, and the reason why digital tools are important is because patients are demanding it. If they didn't, if digital tools like your services for price transparency wasn't something patients demanded, we wouldn't be using it. So it has to be in terms of what our patients need to kind of understand their journey. And if you look at surrogate industries, or in the whole field, like you look at outside healthcare, you see the way customer centric approach is the only way to do business. And healthcare seems to think we're special. We're not. Patients actually need us the most. We have to be the most consumer centric, because patients are reaching out to us in their most vulnerable time with something that hits them really close to home, their health, their ability, their mortality. And when you think about that, it doesn't make sense that healthcare lags behind when it comes to patient or consumer centric care, because it needs to be the one that leads the way. And that's why me getting out of under the hood of actually being in the healthcare system and being able to listen to problems and going, oh, there are solutions out there. That's where, I remember the email I received, the marketing email I received from Aarogram back in the day, and I replied back, yep, you have my attention. What do I need to do to move forward? It was easy because the pitch was simple. It was exactly what the patients wanted. And now we're trying to implement that in our practice, because we also see that happening in other places in healthcare as well. It's slowly becoming a norm for patients to understand, and to go through the we have to simplify the process, right? Because the insurance system we cannot change. We don't have the ability to change the insurance companies. We can only change the way we then interact, because we end up being the middleman. The insurance companies are our payers, and then the patients are our customers, and our customers want transparency. Insurance companies try to reduce the transparency. And so we have to try to deliver what our patients needs in order for us to survive. I mean, this is not about charity. This is about surviving and actually providing care. And we feel our brand of care is something that we need to bring to other patients. And in order to do that, we have to be able to talk the same language the patients want. And I talk about patients like they're a separate, a completely different entity, but they're us, they're you and me. And you buy stuff from Amazon and you click a button, you know it's coming in 2 days, you have transparency, you know what the cost is. So why can't healthcare be like that? And I keep using the same excuses for myself. I say, oh, but healthcare is different. But if you put a gun to my head and you say, is it really? It's like, no, we need to do better. And I think that's where the inertia is to kind of make that change. A lot of practices that are bricks and mortar, they are basically monopolies upon themselves, because, there's only going to be a certain number of practitioners with that skill set in that geographical area. So even if you misbehave, you don't get truly punished. It's a little limited in terms of competition. And so you can, set your shingle outside and do business and do pretty well, and provide very average customer centric care, but still do business. But for us to actually deliver care on a large scale, we have to meet the patients on where their needs are. And it doesn't make sense not to have this level of transparency using digital tools such as Aarogram. So that was my starting point.
Yeah, thanks for plugging in Aarogram into this. But you touch upon a lot of different things, and I would actually, we were planning to cover those things in detail and the rest of the episode. But one thing you mentioned, about the treating patient as a consumer, and you actually went beyond it, that other broaders don't call it like the as a customer. And I know there's a positive connotation to it, there is negative connotation, right? But right now we're looking at a more positive perspective, right? And we'll come back to that, but I wanted to first go to Lane and learn a little bit from his journey, because his journey is interesting as a physician marketer perspective. I that is a world like not many people are, especially even like in the healthcare world, may or may not be aware how it's done, and uh, where it can add the value. So I wanted to ask Lane, like, how did you get started? How and where and what made you, get started working on the patient communication, especially applying digital marketing to healthcare?
Yeah, thank you. So I own a company called Sleep Apnea Leads, where we help dentists get more sleep patients through every stage of their journey in dental sleep medicine. And so we started with actually in 2020 as well, working with our first sleep dentist out in Austin, Texas. And the funny thing about this is that it was never that hard. I've been doing marketing for like 15 years, and primarily digital. I come from a background of doing, I can build Google Ads campaigns myself. My partner builds websites. We know how to do all of the things to be successful. And so when we first got started, honestly, it wasn't that hard to get leads, to get patients to fill out forms, place phone calls. It was fairly easy. We tracked everything. It wasn't that we thought we were doing a great job. And what we found that was really unique in sleep and with healthcare, I think especially with sleep, it was not getting leads. It was getting the patients to come in or get in the chair or move forward with treatment. It was just bizarre, like how hard they would work to or take any opportunity to not move forward at all. If they didn't understand the financials, right? If you didn't take insurance, if you couldn't clearly state like what the testing process looked like, if they had to go anywhere, it was like everything they did. It was just incredibly hard to like get people to move forward. And so I think Dr. Barr, you touched on something so important about just we have to really focus on being more patient centric and providing solutions and options that are more for patients and not for us, and just what's convenient for us, or as convenient for the offices. And so from my standpoint of what we're really focusing on, everything is about really speed. Speed to access the right information that is applicable to your specific point in the process, right? We have AI now, we have ChatGPT. Every time you go Google something, patients are increasingly trusting social media and whatever ChatGPT or Gemini tells them about their medical treatments, and they're expecting to get information right away. Like they don't want to come in and pay the fee to go into the doctor's office to get the information that they think that they can get just on their phone, right? And so how do we provide that information? We build our websites very specific to like, hey, if you're needing a CPAP alternative, you need different information than someone that is just looking for testing options, right? If the page they get to does not immediately address where they are, they're gone. They're not in the right place, and they're going to the next blue link. But even more importantly from there, it's, hey, okay, they're ready to go now. Are you answering your phone? When they fill out a form on the site, how quickly are they getting information back? Not a thank you for filling out our form, we'll be in contact with you, but like a real interaction with someone that they feel like is from the office that can answer their unique questions and tell them what they need to know. Can they get pricing information? Or do you take my insurance? Like, how much does it cost with my insurance? Like, they expect all this information immediately. And the problem is that humans like can't do that, right? I mean, so the stats I always look at are like 90% of consumers rate an immediate response for customer service questions is critically important. If you are able to respond to your forms or patient inquiries within the first 5 minutes, the conversion rates are 8 times higher. Wow. It's because they just expect, right? I mean, and think about the last time you bought anything, or like we're going to get bids for something on your house. Like you filled out 3 forms, and the first person that responded to you probably got the work, assuming they were in the right like price range and everything. And so if you're able to respond fast, you will get more patients. But the problem is your staff can't do that. And so that's where like AI comes in. That's where tools like what Aarogram has, where like they can, hey, I can get my look, what does my insurance say? Like, does this office cover this? Great, I know right away. I know what they need to know. I'm ready to go in. We have an AI agent here called Sarah that responds to text messages, responds to any form submissions via text immediately. I cannot tell you how like just drastically that moves people forward, because now they're not going and researching another office. Like they have the information they need, they're scheduled to come in, like, and so that is what really we're focusing on as far as this space right now is just how fast are you able to get patients what the information that they need
Yeah.
to make a decision about their healthcare and start treatment and get help.
And I think to
Yeah,
build
I
on
think-
that as well, I think the what I find as well is even reacting is too late sometimes, and sometimes understanding what the patients would already want to know is kind of what y'all are doing. You know, the materials you have and how you get Sarah to answer questions, because you know these are the questions the patients are undeniably going to ask. They're going to ask about cost. They're going to know whether my insurance covers it. They're going to want to know how fast can I get in. You know, kind of. So you know already that what these things are. So we have to put this information out there, and we can get access. And in those situations where you need information at that point, then getting that those tools in order. But yeah, you're right. I mean, we have to be really meeting them at the point. And sometimes like things that I was like, oh my God, yes, why it makes sense that should be included. That information should be included in that welcome email. Like, yeah, of course it makes sense. And now we know it. And like, all right, why don't we go ahead and preempt that so that my office doesn't get hit with more phone calls that could have already been answered with a text or an email or a chat bot that can go ahead and answer those questions. So I think, you know, your point is valid, and it's I think I would take it even further and say, and I see that you're already doing that with your materials and how you market with dentists and so on, is to kind of understand what your market needs and then provide that information even beforehand. So patients can go, yeah, yep, that's my question. Boom, let's book an appointment.
Yeah. So I think that behind all of this, I see the strong theme of being like more consumer centric care is happening,
Mm.
and patients are acting as consumers, and they are also expecting to be treated as consumers, right? So all those things you say, they want everything fast, they want all the information up front, they want to have somebody respond to them on demand, and they also want the provider to be actively reaching out to them, right? So all those things may feel like new ideas for healthcare but if you look outside of healthcare, it's kind of normal or kind of nothing out of expectation, for other industries. It's just healthcare is kind of catching up on those things. But then, in healthcare, there are other factors as well. Like you are talking about, providing medical care. So that could be, we have to take care of their, the security risk and the safety and data security safety. And then you also have different kind of populations who may or may not be comfortable using this technology tools. So in your experience, Dr. Bhar, do you think that patients these days are like have only become comfortable using technology tools, or you still have some population who will require some kind of hand holding, or kind of guidance to utilize these tools for their advantage?
I mean, I think the 80-20 rule applies. I mean, I think, most of your patients the 20% is what needs your focus, and those are the ones that are hardest to convert. And yeah, you definitely need more space. I mean, that's where digital tools help, because you need to free up time for your staff to actually do the hand holding for those that need it. And for the rest of the population that is able to, and again, as time passes, there's more and more people that'll be adapt. Like, the number of elderly Medicare population that had smartphones in 2016 versus 2020 versus 2024. All of these you keep seeing, and every grandparent is now getting a smartphone, right, for Christmas and so on, if they don't have one. So, I think that is kind of allowing more patients to jump on board. But not everyone is as slick and easy and kind of savvy with navigating that, and they may trip up in terms of their onboarding. But that's why you kind of have to simplify and just deliver this information. You kind of have to, and I don't want to say dumb it down, but you really have to go, what does the patient really need to know? Like, what is it, and how do I get that information to them as best as I can, and make sure that it's readable and legible, and it's, the font is big enough when you text them and email them and so on, so that it's easy for them to navigate as well. It doesn't require, the least number of buttons to press, the least number of clicks to get to the answer is what you're looking for, because you're building it out for the largest common denominator. And then that way, at least it allows you to manage your 80% well, because that's what allows you to the free time to actually then do the hand holding for the 20%.
Yeah, makes sense. What about your world, Lane? I know digital marketing has been around for other industries. Like, how are you applying those methods, best practices to your kind of work? And another follow-up question would be, do you think those methods, best practice, can be applicable to other types of healthcare services, other types of specialties? Do you wish that more providers would know some of these things than what we have right now, to their advantage? I would say, it could be acquiring patient or even serving them better.
Yeah, so I would say I think we underestimate how tech savvy the population is, especially the older population. Um, I mean, they all have. My dad switched phones to an iPhone just so he could FaceTime with the grandkids. I mean, they all know how to do this, right? They all know how to use the phones. But like using customer centric ways of communication, I think is really the way to go. And I think for us, the big one is text messaging. Um, Text messaging is a 95% open rate relative to email, or doing a chat bot on a website, right? Everyone knows how to do text messaging. Everyone's texting like crazy. They all open it. They can't stand having unread text messages. And having your systems interact with your patient so that you can just text a patient is, I would say, now the preferred way for anybody to interact with not just healthcare providers, but any business. I mean, if you can just text your provider, I mean, that is so valuable, and so easy for everyone just be able to do that kind of on demand. Like I said, it's 95% open rate. It all gets delivered. There's no deliverability issues. It's just the preferred way for everybody to communicate now. And so that's the big thing I would encourage most healthcare providers to add, is some way for patients to text you, just because the interaction rates are so much higher. But then honestly, frankly, beyond that, like, phone still works. If people just answered the phone when patients called, like the older generation, if they're doing, they're going to pick up the phone more often than the younger generation and be willing to place a phone call. And that's what I see with my parents. And so you got to answer your phone, guys. Like, I think we're missing like 35% of our phone calls. I think that's what the study showed about medical offices. I mean, if you're missing phone calls, they're gone. They're moving on to somebody else. So I think we overthink this. I think just think about what you think is more convenient, and apply that to your office, and um, that's how you're going to get more patients to move forward and make this more accessible for people.
I, yeah, definitely. I mean, I think even for us, as much as, Kashyap, you were saying we're ahead of the curve, but we fail every day. We fail multiple times a day. We screw it up all the time. It is scary, crazy, but the thing is this: we are paying attention to the mistakes because we know that if we don't, we will die. Our survival, we have to. And like Lane was saying, it's actually the simple things that we found out is just like you said, it's just answer the phone on time and give them an answer. That's all it is. It's nothing fancy. It's just doing the right thing. And then you have your digital tools to kind of help supplement that, to accelerate or augment your staff able to deliver that information when the phone does get answered or the text message received. But it's just doing the simple things. I think that's one thing I've learned. And we recently went through this whole thing. We got feedback from a referring office that was really poor, and I was frustrated and upset. But then after I heard the feedback, I was like, oh yeah, they were right. and then you go, all right, we got to change. This is good, and we have to. And that's where I think, listening to your customers and trying to then meet them where they want to be met and so on is going to be key. So yeah, I think I wouldn't have been as enthusiastic about Lane's comment, except that in the last few weeks I've seen that firsthand, and it's so true. Do the simple things right.
Yeah, do simple things right. That's right. So this conversation is getting interesting, so I would like to extend this conversation for by 15 minutes, 10-15 minutes, all right? Because we still have some really interesting things that we want to know. And I know, I posed this question to Lane, but I also want to ask Dr. Bar as well, because I see a lot of I see him being very active on social media, you are using, I see like your post every day, which are really good and interesting to read, and very engaging. And then not only you, like I've seen other providers as well, especially in the sleep space and even other spaces, other specialties as well, where people are becoming more active. And you, as Lane said earlier, it used to be, there used to be time then when, patient would just show up, where when there was so much demand of unmet need, and now it's still unmet need, but then, there are other kind of expectations, there are other kind of channels at work, like digital channels. So do you have any tips you would like to share with other providers like you, like how can they utilize SEO, website, social media, even advertising, whatever you have tried?
Ooh, it is an expensive lesson, and it's a lesson we're still learning. and and we're still learning, and we are nowhere close to where we need to be. So I do appreciate the comments about that we have interesting posts. But I think that's where we have to be. I mean, it's like, what was it, the thing about electricity, when, some companies back in the day when electricity was first developed, they're like, oh, we're not an electricity company, but everyone is going to be an electricity company, right? Eventually, everyone will need electricity in the function of business. So same thing as well. If you don't do SEO well, you will not be a business in the future, right? And so we have to. It's not just a marketing tool; it's a tool to survive. It's how we have to manage business. So, I think we've because again we're digital and we're virtual. SEO is also the only way we don't have a shingle we can put on on the street and say, hey, our office is here. We have to tell patients somewhere or another, and that's where there's a lot more noise online. If you're driving in your car and you see a signboard, you don't have too many signboards that are going to distract you, right? But if you're on social media or you're on the web, online, there's signs all over the place. Hey, buy this. Hey, grab that. Hey, do this. So we have to be able to figure out who's our target market and how to kind of speak on their terms as well, and try to let them know that, hey, we do exist. And obviously getting people to your door is one part of it. Like Lane was saying, the lead generation, he found it easy, and that's true. Like, hey, do you want to do this? Yeah, I do want to do this. And then, do you really want to do this? No, not really yet. You know what I mean? So then you have this delay, and then patients don't want to come and get in your seat and then kind of move forward. So I think that's where the lead generation has to kind of also then tie in with the answering patients' questions appropriately, so that, hey, their concerns, questions that most people think about need to be answered quickly. Because, like you said, if you don't get a response within the X number of minutes, you've lost the patient, right? And so that's how competitive it is, and it's going to increase in competition. And even local physician practices and dental practices have to be much more SEO savvy. Otherwise, there's very little chance of
Yeah.
survival.
Okay, makes sense. And talking about the patient as a consumer, there is no kind of consumer journey complete without the payment and pricing and that kind of experience related to their buying journey, so to speak. Um, and when it comes to healthcare, as we all know that pricing is very complicated. There are people who get angry at insurance company, not just patients, even providers also get angry. But the reality is that it is what it is, and we have to right now deal with it until unless we come up with a better system that may arrive in the future. But the pricing for any kind of consumer journey is important, just like in the should be important in the patient's journey as well, care journey as well, right? But the thing about pricing, I would say, on one hand, it's very complicated to get because every patient has different plan, and then there are a lot of other factors that determine their ultimate out-of-pocket expenses, how much insurance is going to pay. On the other hand, if as a provider, if you could utilize this as something, being more transparent, more upfront, and more kind of clear communication, you could actually use this as a hook to establish trust with the patient,
Mhm.
right? So how do you look at it, even from lead generation perspective, Lane, like from the patients that you work with, from leads to so-called leads to all the way coming to the appointment? What does pricing what does the role the pricing plays into in the patient's care journey?
It is.
Go ahead, Lane. Sorry.
Oh, I think it's one of the first three questions that patients ask, and it is the biggest deal breaker if you don't answer it correctly. We have heard
Mhm.
way too many phone calls. There's one that I've almost memorized it because I talk about it so much. It was the guy goes, "Hey, I see you have oral appliances. I'd love to get one of these. I have a CPAP, but I'd love something like this for travel. How much would these cost?" And if I goes $5,000, and the guy goes, "Oh, okay, bye," and that was it, and that was the whole call. And from a marketing perspective, I'm like, I know it came from Google Ads. I'm like, like this was it. Like this is like nothing was more ideal than this lead, and we just dropped it in like 1 second because we didn't know how to more elegantly answer this question other than just blurting out whatever like cash price they had. And they didn't talk through like, well, hey, like let's talk about what is your insurance. Like we typically do some sort of consultation to understand where you are in your journey first. It can depend on a lot of factors. Like, let's talk about you and kind of have a conversation, get some background on you. Let's get your insurance information and then make a decision from there. Talk about, I don't know, financing options. Talk about anything other than just blurting out an answer like that. And so we think it's very, if you don't have a program or something like Aarogram where you can provide pricing like that immediately, we typically err on the side of providing, we want to acknowledge, hey, these are the insurances that we work with, and we provide with the little logos of all the insurance information on all the websites, right? We want that mental checkbox that's a visual. No one reads anymore. You have to have visuals, right? You can't just say you're a diplomate of the ABDSM. You have to put the logo on there. So like the insurance logos are a really good checkbox for patients. So we acknowledge, hey, we do work with your insurance. Again, if they don't have a program like yours that can actually give them the price, Sarah does not give prices. It is, hey, a lot of that depends on certain factors. We want to make sure you talk to the doctor, and we can give you like a really accurate pricing number once we have a chance to talk to you and work with you. And so I just think it's like, it's the most critical thing that I think people miss a lot is how to answer that well. And so it's a big thing where I think kind of a service like yours can help. Again, if you're in network, but otherwise having financing options, having options for patients, and being able to drive home first. Why, right? Why would you pay this much? Like, what are the benefits? It's not that you're getting an appliance that, like, to a patient kind of just looks like a mouth guard. It's a lot more complicated than that, but like it looks like that to them. It's not. That's a solution. Making sure that you're driving home your benefit language with, hey, no, what you're buying is 15 more years with your grandkids, right? What you're buying is more energy for every day of those years, right? Like that's what you're getting out of this, and that's why you want to move forward with this, and that's why this price now makes a lot more sense when you kind of contextualize it in the value of that much more years in your life.
Yeah. Dr. Barr, you want to add to that?
No, I think that's true. I mean, it's actually it's. I hate this, but mattress companies kind of have it so easy because every time by the time they come to us, they spend thousands of dollars on that to fix their sleep, and then they come to us and like, what do you mean my cost is going to be $200? I'm like, hold on, you just spent like dump $5,000 on a mattress that hasn't done squat except maybe make you feel slightly better. This is a medical condition we're treating right now, and this is too much. So I do think trying to get the patient understand the value that they will get. Like you said, don't just say, oh, it's $5,000, and you're like, oh, thank you very much. It's it really comes down to saying, get understanding what the needs are, because every customer has a different pain point. There's like I had a patient that the only way I could get her to use a CPAP was because I touched on the fact that she had eye bags, and she was like, yeah, that's what everyone tells me. And I'm like, it will improve. And they were like, oh, okay, yeah, I see it. Yeah, that makes sense. And then she was all for it. But I told her about the blood pressure issues and the heart disease 10 years down the road. She was like, fine, I'm okay. A coffee's good. I feel better already. But, you kind of have to kind of touch the patient where they see the most value. And sometimes we miss out on that because we hide behind this, oh, I am a doctor or I'm a dentist and I've been trained very well. And if I told you something, you should listen to me. And that day is gone. That era is gone. And if you're still living like that, you should be retiring soon. So, it definitely is something that we have to do a much better job at, is actually just connect the value proposition with the product that we're selling. We're not just selling, hey,
Mhm.
we're selling a widget. This could be life changing. And I'm a sleep apnea patient myself, and I can tell you this, I know the value. Like every time a patient goes, oh, it costs this much. Like if you calculate it based on the amount you spend a day, this is the cheapest thing you will spend for your health ever, period. Like fix your sleep.
Yeah.
Every day you wake up better compared to what your quality of life is without it. Are you kidding me? Are you not willing to spend 50 cents a day? If you break it down to the number of years they end up using an oral appliance, the number of years they use a CPAP, but someone will spend 250 on a latte in Starbucks without blinking, and consider that they're treating themselves, self-care. I'm like, try 50 cents for your sleep for a day. That makes much more. But again, we're not making the sale the way we should be, because healthcare has always been about, we're this wall healthcare system. You come to us when you're sick, we will fix you. Don't ask about cost. And if you ask about cost, we'll send you to the collections agency. You know what I mean? Like there's those days are gone. And so I think we do have to kind of actually explain to the patient where they actually see the benefit, and tying
Yeah.
that to cost. And that's where the transparency comes in, because then you can actually show,
Mhm.
hey, it may be 5,000 potentially, but if you go through insurance, you meet a deductible, this is what it could be. If you do financing, this is what it actually costs. You know what I mean? Like meeting the patient where they're like, oh, then like, oh, okay, yes, I understand that. That makes sense. And I think that's where we have to do a better job at. And that's why digital tools like Aarogram really help, because it does make it easier for our staff to figure out the craziness. Because as a physician myself, oh my God, I got my son's healthcare bill and I couldn't figure stuff out. And this is what I do every day. And I was like, what is this bill? What is
Yeah.
that bill? What's the EOB? I'm like, and so I can imagine when someone is it, interacting with the healthcare system and or the
Yeah.
insurance system is just befuddling. So having clarity is definitely helpful, because then the price is there, and as much as say price
Yeah.
cannot be attached to value, there is. People see the price and then they immediately quick
Mhm.
back of the head or back of your envelope calculation. And unfortunately, sometimes they come up with a wrong estimated cost because they don't think about how much better my life would be. Like the grandkids and
Mhm.
playing with your grandkids and so on. They don't see that part. They see pure dollars and cents, and oh my God, this is another money grabbing thing to sell me something else. It's like we're selling lavender oil, but hey, maybe we should.
Yeah. Yeah, well, thanks for putting things related to pricing in perspective, and uh, you know kind of giving the full context, where how it plays the role. So I think, yeah, that's where we have to also keep in mind. We like to keep in mind at Aarogram when we work on product day-to-day basis. So it's very important to have this as a reminder, where we are in the system, what problem we are solving, how it matters to the other stakeholders. So yeah, thanks for sharing those perspectives to both of you. So I guess we are kind of about the time. I wish I could continue this, but I guess we can carry this forward maybe another time. But for now, I think it was really fascinating conversation. I uh, learned a lot of new things. I got new perspective, and it was fun conversation. I really enjoyed it, and
Oh,
hearing about all the stories that you shared, Helene and Dr. Barr. So yeah, thanks for coming,
having
joining
us as
us
well.
on this.
Yeah,
Yeah,
thanks for having
yeah,
us. Let's do it again.
yeah.
Happy Friday.
Just a closing remark. Yeah, thanks everyone. Closing remark, Shruti, you can wrap up.
Hi, thanks for coming, both of you. That was a really intriguing conversation to be a fly on a wall for. And I really, really want to invite you back so that we can do it again and take our conversation further. That was really fun and very interesting to hear. And I'll be leaving links to each of your businesses in the comments below. If anyone wants to grab a consult with Dr. Bhar, I'll leave your website and get in touch, talk to Lane, get in touch with him, or speak to us at Aarogram. I'll be leaving all the details in the comments below. Please tune into our podcast as well. We do a podcast as well as a newsletter. So I'll be leaving. Please subscribe to it, and see you soon.
Thank you.
Thank you. Have a good weekend, everybody.